So while it's been agreed in mental health circles that prevention is the best method for circumventing addiction, our country continues to follow a path of criminalization as its main deterrent for addiction. You may not be aware, but there's this other little-known war waging in the womb, and it asks the question, does criminalizing women for the state of their children at birth actually deter their drug use? Most recently, we've seen this concept take aim at pregnant women and their unborn children. There are new laws in several states and reconstruction of existing laws that actually allow for the punishment of women who use drugs during pregnancy. We're seeing it predominantly in the South, but in fact there are 17 states that, under civil childhood welfare statutes, it's implied that drug use constitutes child abuse. Alabama, for instance, has become known as one of the harshest states in the country with their chemical endangerment law. It works under the idea that fear of arrest and loss of child custody will be a deterrent to use and abuse of illegal drugs. Currently, between 2006 and 2015, 479 women have been charged with child abuse in the state of Alabama. The standing belief behind Alabama's law, and others similar, is the protection of the fetus, which works under the premise that the fetus has separate interests that are equal to, if not greater than those of the pregnant woman. Beginning last year in Tennessee, they began forcing staff at every hospital to start reporting such cases, and the numbers are still spiking. And in the face of these troubling numbers, health officials have made drug-dependent babies a priority, and the state government is turning to drastic measures. Without even taking the mother into consideration, advocates for criminalizing drug use during pregnancy argue that the fetus deserves the right to potential life, the right to be born free of birth defects, and the right to a healthy mother. Conversely, though, the same study posed an argument on behalf of pregnant women. And it stated, and this is coming from the Convention for the Elimination of All Forms of Discrimination Against Women, which supports that the fundamental principles of non-discrimination and equality require that the rights of the pregnant woman be given priority over an interest in prenatal life. One legislator here in Tennessee originally wanted to allow for homicide indictments for mothers if their drug-dependent newborn died. Women today finding themselves in this situation now have the option to seek treatment for their substance abuse. However, in a research study conducted by Rebecca Stone for Health and Justice, she discovered that here in Tennessee we only have 5 clinics in our entire state that accept pregnant women and Medicaid. And the bigger issue here, at least in Tennessee, is that most of these facilities are in our urban areas, making it even more of a challenge for the pregnant moms who live rurally to consistently get treatment or even to keep up with a treatment program. So another study that I looked into was done by Vanessa Soderberg for the Berkeley Journal, and she found that here in Tennessee, drug use specifically was not criminalized for any other group except pregnant women. But here's the catch on that, because the same study also showed that our U.S. Supreme Court stated that to suffer from a drug addiction cannot be considered a crime because addiction is a status, and this places it in conflict for criminalization. So, while proponents of legal action against pregnant women tend to believe that it is a viable deterrent and truly honestly believe that it is in the best interest of the unborn child, opponents support the treatment, the health, and the well-being of the mother in question. They want her to deliver a baby to term, and they want her to be healthy. A survey done by Flavin for Duke University cited that women actually have the desire to get better, and they want to stop using. In another independent study on women's health that was done by Sarah Roberts and Amani Nurjeter, they involved 2 focus groups, and their results showed that their participants actually feared being identified as users. They felt like they had failed as mothers, And they actually didn't even trust their providers or their doctors to have their best interests at heart when it came to their prenatal care. The American Association of Addiction Medicine was quoted in that study as saying that to inhibit a pregnant woman's opportunity to receive effective prenatal treatment, to address her long-term recovery from her substance-related disorder, is not a compromise she should have to make from fear of being incarcerated. In combination with the fear of arrest, shame is a huge aspect for most moms not seeking out prenatal care. There have been occasions where in a doctor visit, they've been outed to other family members because of the discussion of test results that were done. Some other women in the survey said they really had a lack of trust for their physicians and their confidentiality as a reason for just not continuing to seek out prenatal care. It also showed that in some of the absolute most extreme cases, women were giving birth at home or seeking out abortion. From a medical perspective, some scientists have said that meth in particular does not have a long-term effect on a developing fetus. While there are withdrawal symptoms immediately, there is no long-term effect on the development. Dr. Carl Hart of Columbia University stated that heavy alcohol use actually is potentially far more serious because of things like fetal alcohol syndrome. Alcohol, completely legal. You can go buy it right around the corner. This idea has been confirmed in an article that I read at The Atlantic that noted that there's quite a few studies actually that show that in utero exposure to illegal drugs doesn't harm children in the long term. The American Psychiatric Association urges that society resources shouldn't be directed toward criminalization, but be directed toward adequate preventative care, services for mothers and children that are caught up in addiction. For the pregnant abuser, I feel that the Roberts and Neurojeter study came to what might be the best conclusions. Their results suggested that more emphasis be placed on provider training to include, not placing judgment on the moms and to be a little more compassionate and understanding. It also called for better policies for communicating information, particularly screenings, blood screenings, urinalysis screenings, and what they're actually testing for. And lastly, in support of a better means of confidentiality on the use of drugs and alcohol. If it's discovered through prenatal testing, it should be discussed with the prenatal mom and not immediately reported as abusive. I spoke with Jessica Young, an obstetrician at Vanderbilt University, who specializes in drug treatment during pregnancy. And she believes that, lawmakers don't fully understand that addiction can be a sickness. It's a disease. It is a disease. Her very simplistic statement supports the medical community overall and my conclusive point that vilifying or, attempting to manage an illness like addiction through legislation and incarceration is not going to support abstinence or recovery. But I'm going to close with this quote from Dr. Deborah Frank that I read. She's a pediatrician and the director of the Boston Medical Center's Grow Clinic for Children, and I think it sums everything we've talked about up pretty well. To simplify a complex medical and psychosocial issue into a criminal issue is really just like using a hammer to play the piano.